And here's our lovely
Emily.
what?
Emily.
Yes, I know her name, Emily.
Oh, I should check it.
Hello.
She's just the dictator of the place.
Not quite.
She's an amazing woman. She really is. She can speak Creole like the best of them.
And scrub floors.
And scrub floor. She does whatever it takes. And then we have, this is the treatment room. And there's Sue. Say hi, Sue.
Hi.
Oh, hi, Sue. You must be Sue, too. We must have two Sues.
Oh, Margaret's a nurse.
There we go.
It's a doctor.
Yeah. She's not.
I just play it on my TV show. These are all our instruments here. And these are our happy patients. Can I sign it? Have you sign a release for me? Well, here we are on our 2012 trip to Haiti, and one of the Shar, one of the physicians on the off-site, had discovered a patient who has a partial denture, that was made. She had a couple teeth removed, and this was made. If we look up closely at this, this actually has a flange on it, and that flange is too long. And what happened is this woman was wearing this, and this thing developed, I believe, probably because that was an irritant in the tissue, and now she's developed this very large area here of this swelling. I think it's some type of a granuloma. But I think what we can do is just numb around the border of it and then excise it. We put on blood pressure medications to lower blood pressure so she has minimal bleeding that way. And we also have some epinephrine that we're going to use to also help the hemostasis with that. So I'm going to show this procedure as we do it. Okay, you can hit the button. Hit the stop button. I'm just going to numb up, and you can see if this thing moves. So I'm going to come in and just try to infiltrate around the border of it a little bit. And just so that when we excise it, that it will be okay. This is a very large, I don't think I've ever seen anything as big before, but this type of condition. So I'm going to go in and just try to numb up. It's amazing the Haitians how unbelievably tolerant they are of the local anesthetics I give. I don't know. I think I would be without my job at home if I could see them this night. Let's see for a little pinch here. And there's pus coming out. No, it's not. I can go ahead and cut that away. Turn off. Come a little closer. Coming closer.
Okay.
So right now we can see that this thing is size it right now.
What if it explodes?
What?
This is looking the other
Just
way.
a little plus sign. Oh, you having a hard time with this?
She's alright.
Yeah, like that.
Keep an eye on Sue over there.
It's like going to Hardee's.
That's not going to be a nuisance.
There you go. It doesn't have a large base when it's growing from. It's pretty disgusting.
She didn't bleed that much, did she?
Suction right there. So the base is only about, you turn your suction on a little bit more? Yeah, there's not a lot of bleeding here. Really.
Thank you. Thank you.
Oh, it's just a small little spot.
Wow, that came off really easy.
Yeah, it was very pedunculated. It's okay to look at. In fact, oh my gosh, that thing only grew from this little spot where it's bleeding right now. That's it.
Wow. So she's going to have a good recovery.
Excellent. She'll be fine.
Good.
Okay, so that's it. It's only a small little itty bitty spot. That's good news.
Lite
I'm not
Latesa.
You're not gonna do it? No.
Oh, open this for nothing.
Yeah, so I'm just going to put a little of that epinephrine on there. Actually,
Just throw that in the sharps when you.
I think what we'll do is we'll just have her pinch this here. Can you have her just pinch? I'm going to let her pinch it.
Do you want me to hold it?
You can do it. No, have her do it.
Ok. Prends main où et mettez yon main là et yon main
Right here.
ici
And have her pinch, right?
et
Here.
fermez main où et
Alright.
poussez.
And pinch real hard.
À campion force. Comme ça. Is she on her now?
Yep.
Poussez, poussez.
A lot of pressure. Just have her put pressure. Before I start using any chemo stuff.
Ça part les sangs camper.
Where's the piece? Small. Okay, why don't you take this from me? Take this from me.
Okay.
What, you want me to turn it off?
Yeah. Okay, so that only had about a 3 or 4 millimeter surface area that this thing was working by. And this is whatever it is right here. And it was just very little attachment to it. So that's it. So that whole thing was caused by trauma from her. More than likely from her partial that she has. Now, I'm going to adjust this partial so that it actually doesn't even hit hard.
No,
So it's not even resting too high there. So
it's hitting on this part of it, right that, what is it? Here?
yeah, right there. Yeah, I can take care of that. But see, now it fits her. She's going to be very happy. Okay. Great.
Here we are at Hope for Haiti at the dental clinic, and Robert is removing a tooth from someone. He's had 3 teeth already extracted, and he's removing one more.
There you go. And this is from when not brushing your teeth and eating sugar cane all the time, but brushing your teeth is really important every single day, because 3 times a day. That's right. See? And having music instrumental. I've been having instrumental accompaniment with that one.
This thing clogged.
Probably he's got so much tartar.
And here are his teeth right here that they pulled out. You can see his tooth right there. Brush your teeth.
So this is from, these are holes in her teeth when she has made sugar cane and sucked on the sugar cane. The sugar contains sugar, of course, and the bacteria in the mouth uses sugar as a food source, and that makes an acid. And as the acid sits on the teeth, they make holes in them. And you can see this right here. We're going to, fortunately for her, we're going to be able to do some fillings on her and make them look nice. But there are many people we're seeing today as we are having to take the teeth out because they're too far gone. So the key is, don't eat sugar cane. We'll show you how they're looking as we progress and do the fillings on them.
This man came to the dental clinic and he's having several teeth extracted. About 8. 12, I think. And is it 12? 12 teeth extracted. And so they're working on removing them, and there's a lot of blood that comes from it with it. This is probably because he didn't brush his teeth and because he ate a lot of sugar cane.
Can I get another anesthetic, please?